Well, hi. Welcome everybody to our wonderful monthly virtual webinar. And tonight we have our wonderful, wonderful guest host, Lauren, who's going to be helping us out discussing Tempsure Envi, our favorite way to get beautiful lid lift, great gland expression, and skin tightening of the face and around the eyes. We prescribe it all the time for ocular surface disease, but we're going to go into a little more detail on that tonight about all the other beautiful things you can do with Tempsure Envi. And we have the brand new Tempsure Envi handpiece, which we have been able to test out for the last few months. And it is absolutely amazing and marvelous and comfy and just, oh, so yummy. Just makes your eyes just feel glowy, warm, and just deep, wonderful heat. It is awesome. I just can't say how many times I'd love to have it done every week if I could. And we also have our lovely Amy, who is our Tempsure Envi technician. Amy, give a wave. Woohoo. Amy's going to be doing the treatment on Stevie, who everybody knows Stevie in the practice. And Stevie is our hostess with the mostest, who's our optician and our lead on aesthetics. So she gets to see Stevie is warming up for the treatments and prepping. I'm thinking she's going to fall asleep on you, Amy. She's going to be so relaxed and isn't going to want to leave the office.
No, I won't let her fall asleep. if I have to be awake, so does she.
She does too. I love it. I love it. And then of course we have Gabby, our advanced laser esthetician, and she's going to be, giving some feedback on when she's doing consultations with our patients and why she loves the Tempsure Envi as well for skin tightening and helping our ocular surface patients. So we're all going to be weighing in tonight and doing our normal thing that we do every month. And so right now I'm going to kick it off to Lauren, and Lauren is just absolutely fantastic. We've been working with Lauren now for over 3 years, and she's helped us so much doing these wonderful virtual events. She is our partner with Cynosure, which is the developer of the Tempsure Envi machine. And I'm going to let you take it away, Lauren.
Thank you, Dr. Foley. Happy as always to be here. Oh my goodness. Okay, so I'm super pumped. Hopefully this presents well. It is in a PDF, but we're going to go through just what Tempsure is and how you can benefit from it, what to expect during a treatment. I'll touch on the aesthetic side of things. So of course, Cynosure is an aesthetic laser company, but people like Dr. Foley are paving the way in leveraging this technology to help in a lot of areas with clinical applications, such as with dry eye treatments. So with Tempsure, it is a treatment that uses radio frequency to essentially heat up the skin, create a controlled thermal injury. So it's just going to warm you up, feels like a hot stone massage. And what that actually does is we kind of massage out those fine lines and wrinkles. And overall, what you get through the treatment series and the long-term benefit is new collagen and elastin that's been created. That is the building blocks of your skin. So it's super important. We'll kind of get into why we need to do that. So the problem, we all face it, whether we want to or not. And it can start really affecting us as early as, early 20s. But our bodies, right, we make collagen and elastin. I look at them as kind of like the brick and mortar of the skin. So that's what creates your foundation and your strength. The elasticity is really kind of that bounce back you get, and that collagen is that strength. So as we age, our bodies stop making it as often as they did when we were cute little babies and cute little teenagers. And our body actually starts breaking it down over time. In addition to not making any more of it, it's also fighting us on it. So in order for us to have kind of that smooth, tight skin, we have to do things that stimulate new collagen production because our bodies are not here to help us in that category. So, there's skincare that you can use. Dr. Foley does have medical grade skincare at her practice that can really partner well with both the Tempsure radio frequency as well as the Icon IPL. But essentially what we're doing is we're stimulating that new collagen production to rebuild the skin, get rid of the laxity, and restore that youthful look to us. Now, I'll go through the solution, which is Tempsure Envi, but the exciting piece of it is really the application that it has with dry eye. So basically, Tempsure is going to come in. It's safe for any skin type, any time of year. We can do it on the full face and the neck if you want. It's a pretty quick treatment. We're going to do a live demo of one. But basically, you come in for a series of these. Dr. Foley's recommendation is one per decade of life. And that seems to be a pretty tried and true rule there. So understand, as a patient coming in, it may look different for you than it does for your friend, is how many treatments you need. Everybody's skin is unique. But basically what we do is the Tempsure Envi is going to actually gently heat your skin. It triggers that healing response that produces new collagen and elastin. So that's where we're kind of correcting that aging that we've seen over time. These new collagen fibers are super tight, they're dense, and it ultimately results in younger looking skin. When I tell people this, they always ask me, well, is it permanent? And I say, yes, the collagen and elastin we made is permanent, but you're still going to age and your body's still going to be fighting you. So you come in, you get these treatments done. As you can see, that collagen synthesis happens, and then it actually reduces those fine lines and wrinkles as it's tightening and developing your skin, really. So, we go through and we kind of correct. With a face only treatment, we kind of section it up. So if you're coming in for your eyes to be done, you're going to have 5 minutes one side, 5 minutes the other. Maybe we're going to do your forehead too. It's a relatively quick treatment. You can do it on your lunch break if you want. The more area we do, the longer the treatment takes. We are bulk heating that tissue to get us that neocollagenesis. And so actually, Dr. Foley, if you don't mind, I'd love to pass it over to you to talk about the dry eye piece, because we get the lid lifts and everything like that as we're tightening and lifting the skin, so that, we can get pretty close to the eye, right, when we do these treatments. So not only are you getting an aesthetic benefit, but especially when we do those treatments, educate us a little, Dr. Foley. What else are we getting?
Sure. Well, some of you guys have heard me talk about this ad nauseum because I am so excited about this, and it's been so fabulous for the practice over the last 3.5 years since we've been using the technology. But basically, my subspecialty has been over 15 years, and all I had in my toolkit for a long time were artificial tears, lid hygiene, and warm compresses. And I'm sorry, warm compresses just are not enough to get deep, deep heat where those glands reside, deep in the lid structure. So radiofrequency goes deep in the dermal tissue, heating up the water molecules deep in the dermis, which are surrounding those glands, which then creates that deep heat around 40 to 41 degrees Celsius, which is the magic number to get those little oil glands starting to pop and melt and express. So that wand going around that feels so marvelous is gently massaging those glands, expressing the oil, thickening the tears, and making the vision more stable throughout the day. In addition, it helps to get better structure back to the upper and lower lids. So when you blink, you're a more efficient blinker instead of those loose, floppy lids. And that causes atrophying of the glands, and it causes recession of the lids. You've probably seen some people where the lids are getting really loosey-goosey and droopy. It can tighten that up, lift it. So not only aesthetically more pleasing, but more structural component there. So as you are a more efficient blinker, get the oil out efficiently, and you see more clearly. In addition, we see a snugging and tightening of the whites of the eyes, which can be really bothersome from some of our patients, where they get that tearing constantly out of the side of their eye because they have this bunching of tissue that causes a waterfall effect. And that is wonderful side effect of the treatments of snugging and pumping up. So it's kind of a lift and separate, which we love to do all over our bodies, but Tempsure does it best. And we're seeing fantastic resolution. And as Lauren alluded to earlier, we continue to lose collagen and elastin, which means we do need the occasional touch-up treatment. We do a series of treatments to get to that effectivity for ocular surface dry eye. And then we need to do the occasional touch-up either once every 6 months or once a year to keep those glands functioning properly. So it's beautiful because we get people off their expensive eye drop medications, which is wonderful.
I like the restoration of kind of normal daily living too. I personally also have dry eye, and it's gotten worse since moving to the Northwest. And for me, like, I wear eye makeup almost every day. Like I'm not a big makeup wearer, but I certainly have mascara on most days because I don't do my false eyelashes. And and so I know, gold star. So but it's, you know, it's something where like putting like drops in all day and stuff, like I'd rather just blink my contact straight out of my eyes because otherwise I mess my eye makeup up, right? And that's a really superficial kind of example. Oh, do we have Amy? Did you ask me to say? Oh, okay. Sorry. But yeah, so for me, like I tell people that too. I'm like, it's cost, it's time too, right? Like you come in for maybe an hour, 3 to 5 months in a row, you got this wonderful treatment. And even, you know, I like just learned something even from you, Dr. Foley, like just talking about this often, you know, one thing that I tell people is if you're coming in for a dry eye treatment, you're going to get the aesthetic benefit regardless, right? So that's really fun. But to your point, it sounds like, and it makes sense, right? Because I've heard stories of people who have maybe needed blepharoplasties who have come in and done significant series of temperature treatments. We're certainly not, you know, saying this is a one-to-one to a surgical procedure, but people that aren't as advanced in that, you know, kind of laxity that they have, being able to come in and get this treatment done helps them so much. And even from what you're saying, if they're coming in for that dry eye, even rebuilding that structure around the eye even just enhances their long-term result further. So I love that.
Yeah.
One thing I'll also share too is I'll never get over this. I was in a demo with a Tempsure and there was a patient on the table. She worked at the spa that we were at and literally has had to call out of work as an esthetician because her eyes are so dry, she can't see. And she on the table, I mean, it was tears coming out of her face expression. And she texted us later that night and she goes, today was the first time I've ever driven home and actually been able to see clearly and read the road signs around me. It was like, she's a new person now. And I just love stories like that because it just, you know, it's just so incredible the impact that we can have.
I have a story too. We had a patient that came in. She bad shape. She hadn't read. Was an avid reader. Hadn't read a book in 10 years. She came in for her third treatment, and she was crying because she actually got to read a book from cover to cover. She was so excited.
It's the simple things. It's the simple things. But that's why I love this treatment because it is that longer term fix that just gives you so much back in your life as far as quality goes, whether it's not having your mascara run down your face or being able to see the road sign for the first time or being able to read a book for the first time in years. So the treatment, there's no downtime with it, which is one of the wonderful things about it. You'll be like a little pink afterward. We'll see once we do our live demo here shortly. But there's no like really precautions outside of, you know, wear sunscreen because you should just be doing that anyway. So,
we have a quick question
go ahead, Gabby.
Before we move on from Terry. She said, what happens if a person overuses eye drops and artificial tears? Now, as far as I know, artificial tears, as long as they're preservative free, you're kind of good to go, right?
Yeah, and that's a great question, Terry. Thanks for bringing that up. Basically, preservative-free artificial tears are probably not going to cause much harm to the eye. They give you some temporary relief. They aren't solving the underlying ocular surface disease problem of inflammation and clogged glands, but it can give you some temporary relief. We usually recommend the more oil-based artificial preservative-free tears like omega-3 or sustain or retain. But as a rule of thumb, the ones that you want to avoid are the preservative ones in the multi-dose bottles. Those are nasty and have bad chemicals in them, especially good old Visine that gets the red out. We never want anyone using that. It's really harmful to the eyes. It strips those fragile oil glands. And the majority of those over the counter right now that are the ones we reach for are usually very, very harmful to the eyes. And some of them can cause issues with heart issues, especially Visine, Murine, Clear Eyes. Those are unfortunately not good. Lumify is okay to use over the counter if you need something for redness, totally safe to use, is a go-to that we all recommend here in the practice. But again, artificial tears, all I had back in the day, not very helpful. But again, they aren't going to hurt you.
Awesome. Thank you. So this is pretty common. We have this obviously here in the presentation, but I think everybody that's on the panel has had Tempsure done at least once at this point. And I have practices that literally have patients coming in once a month just because it feels good. So not only do you look younger, but it is so enjoyable. And honestly, in aesthetics, we cannot say that much in that regard. And certainly in the medical industry, you don't come in for a medical procedure and walk out feeling relaxed and refreshed. So we love this. Here's some before and afters, right? So these are, obviously of the eye area. What we're looking at really is that tightening that we're getting, that reduction in fine lines and wrinkles, some volume restoration a lot of times. Even this lid sits a little bit higher than it used to in this first, and this is only 2 treatments, which most patients are coming in for 3 to 7 treatments. This other one, this was also a 2 treatment series. And so we are really smoothing out those fine lines and wrinkles, but also just rebuilding the structure and plumping up her skin. So here's the other side of those. This actually is just 1 treatment on my left. And then the other one, we actually went through and did a 3rd treatment for her at that. So even looking at her, like eyelid laxity is really improved under the eye, the bag is smoothed out. And then of course, a huge improvement in her fine lines and wrinkles. Here we have some more where we were just really even for 2 treatments. And honestly, especially this patient, I guess on, the 2 treatments, right? Okay, the 2 treatment patient, that person obviously is over 20 years old. And I still think that's a beautiful result, but I would die to see what this looks like after, the appropriate number of treatments, which will probably be about 6 or 7 for them. And then yet again, another nice, beautiful treatment that we saw here. So if Tempsure, is Tempsure right for you, right? So rule of thumb in the optometry world is you have dry eye until you prove you don't. And especially us in the Northwest, I think that is a very underappreciated term and saying, because of the fact that we live in a super dry climate. All of us struggle with it. It's gotten worse for me since I've been here. And I talk to people every single day who have that issue. So obviously you want to go see your specialist, like those at the Foley Vision Center. They'll let you know after doing your consult, maybe a mammography scan, what we're dealing with. But it is safe for all skin types. You cannot say that about all treatments. So it's certainly important and a specialty for this platform. It can be done any time of year. You typically are going to come in about once a month, each month for your treatment series. So about 4 to 6 weeks apart, maybe a little bit more aggressive. Your providers will have the best knowledge on what works for you. And so even if you want to come in and do this for the aesthetic benefit, right? Wedding prep, whatever have you for events, you definitely want to start those 3 to 6 months out just in order to achieve that optimal result before showtime. So most patients do see, actually, I'm going to scroll back as far as when do you see results? So this treatment is 100% immediately post. So you see that pink there, right? So this is what you're expected to look like when you walk out of the treatment room. For most patients, it subsides pretty quickly. We do notice a plumping in the skin that happens for a few days after the treatment. And then you do see some smoothing, some new skin has been created. So you are going to look brighter and glowier, but we actually see the full benefit of those treatments 6 months after they have happened, because that is how long it takes the body to complete the full neocollagenesis or new collagen creation process. So it's definitely something to keep in mind. And that's why we certainly recommend starting your treatments much earlier than you think you might need to. I guess for you, Dr. Foley, I'm going to stop sharing. What are you guys typically seeing as far as timeline to result? What is kind of your patient satisfaction for dry eye? Give us a little insight into how you're seeing the success of the device work.
Well, for me, the whole reason I got the device was to treat ocular surface disease, and then the happy accident of all the aesthetic side benefits, as I call to patients. There's going to be some side effects to these treatments, and they kind of go, oh dear, you know, they're thinking I'm going to tell them they've got all these things that they're going to have to. And I say, but the side effects are ones that you're going to actually enjoy, because it helps with the fine lines and wrinkles and lid lift and whitening. Kind of, it just lightens everything up, and patients are like, oh, well, that's a nice side effect to have. And we're seeing wonderful results. You know, the big thing to me is patient comfort and clarity of sight. That's always number 1 and 2 for me. And all the patients usually will say after the first treatment, they're getting some sense of this just feeling, a more moist, comfortable, yummy feeling to their eyes. And as it continues doing the treatments, then you start seeing the cosmetic side effects, which is super cool. I get to see them by the time they're done with all of it. So for me, a lot of times it's shocking when I walk in the door, because I remember them when they first come in, and then I'm like, oh my God, this is not the same person that is in my chair. So it's quite exciting to see that. So it's more fun. It's like when I go and I see kids coming in where they were like 8 years old, and now I see them when they're 12, and it's like, whoa, who is this moose in my chair? You know, it's just that big change. That's really remarkable. And I'm sure Gabby can attest, because she does a lot of our IPL with our patients. So she'll see them intermix doing radio frequency and IPL. And what do you notice, Gabby?
You know, the only thing I have against radio frequency is that everyone prefers Amy, because she gives the massage, the nice little fall asleep. And then I go zapping people afterwards, and they're like, when do I get to go back to radio frequency? So, I mean, that one, obviously, it gives a lot of people instant relief, which is amazing, because, you know, you get to walk out after maybe 30 minutes to having like a bunch of oils in your eyes, and it just feels amazing. And I do like that, you know, there's an option for all skin tones, because with IPL, you know, you're kind of limited to half the people, and the other half, it's like, okay, what do we do with you? And thankfully, radio frequency is kind of the catch-all for everyone, and we're able to get good treatments for everyone. And that's definitely makes me feel a lot better about the people that I don't get to treat, because I'm like, okay, well, I can't zap you, but we can go ahead and give you a spa treatment.
That's
Yeah.
great. I think Terry put in our question. She said, Dr. Foley's been doing these treatments for over 3 years. The Dr. Foley way, yes, I have put up the protocols for this, has finally become the Mayo way. Oh, that's very sweet of you, Terry. But she noted that last month in September 2022, the Mayo Clinic published the following: a technique called intense pulse light therapy followed by massage of the eyelids may help people with severe dry eyes. And that's true. So we use radio frequency and intense pulse light, or IPL, together in many instances to treat these severe dry eye patients. I think what we're going to do right now is Amy's in the process of doing Stevie here. So we want to show what this looks like. So I'm going to try to highlight and spotlight Amy here so you guys can see what she's doing. Okay.
And for those just joining, this is with the new Tempsure Envi handpiece. So the benefits of this are you put a lot less pressure around the eye. You're able to heat up 70% faster. And it sounds like, Dr. Foley, it's overall just helping you, you know, really in your dry eye practice.
Oh yeah, very much so. So Amy, can you talk and do it at the same time?
I can. I just wanted to, I was trying to break in, but I didn't want to, jump in. And I didn't want Stevie to go home lopsided. So I started her left eye first. So yeah, the new handpiece is really amazing. I started off with the old handpiece, and the most complaints that we received were the pressure. People did not, rightly so, because you had to push pretty hard with the new hand, or with the old handpiece. But this new handpiece, they did amazing. Okay, so I'm just gonna kind of walk you guys through it. So first, I cleaned both eyes with alcohol swab, a little towelette thing. We take our ultrasound gel that we have heating in a baby bottle warmer, the best thing ever, because it's heat activated, the machine, we want to make sure that we're up to temperature. And if it's cold, if your gel is cold, then it's just going to take longer. So heated gel, ultrasound gel, and then we're just going to kind of put it around the eye. And then you will see two lights. There's going to be a green light at the top and a blue light at the bottom. The blue light is letting us know that we are pushing hard enough. The green light at the top means that it's working. So touching. Once you can see that this green light is blinking, once that stops blinking, it's telling you that you are at temperature. We are at temperature now. That's when the time starts ticking down. So we're just going to go around your eye like this, as close as you can, just around that orbital bone, because you don't want to go right over the eyeball. We don't want to hurt them. And then you're just going to do this until there's, I don't know, about a minute 20 left. And then we're going to do 40 seconds on the upper lid, 40 seconds on the lower lid. Stevie, how do you feel?
Great. Yeah, I can tell a huge difference in the new handpiece than the old handpiece.
Yeah.
Very appreciative for the new one. Thank you, Dr. Foley.
Another good thing to keep in mind with radio frequencies, it's good to be hydrated beforehand. So if you're already a water drinker, perfect. If not, definitely start drinking some before your radio frequency treatment for the day before and leading up to it.
Yeah. Thank you for saying that. We totally missed it. That's pretty much that's the pre-treatment, kind of instructions there. You want to drink like 48 ounces of water before you come in the night before. Radio frequency is attracted to water. So with IPL, we're attracted to a color or a pigment, which is why we're limited on darker skin types. With radio frequency, it's attracted to water, and it will affect the outcome of your treatment. So sometimes we have patients that come in, they do a couple of treatments, we really struggle to get to temperature, and they don't get a great result. And we can tie that directly back to their hydration level. So water is RF's conduit. So it's searching for water, and we want it to flow easily through so that we get that efficacy. The device actually can do real-time temperature monitoring. So we know whether we're at heat temperature or not. And we can make modifications in the treatment room to overcome some of the challenges we face, but that is such an important component of preparing for your treatment.
Yeah, not only do you get up to temperature quicker, but since, that water is kind of what causes that micro injury, which then promotes that collagen, that elastin. And so I try to tell people, no matter what, you should be hydrated, but at least.
Well, that's a good rule of thumb for life. Drink your water, people.
Right.
I love it.
And it's water. I have people go, but I drink coffee all day. That doesn't work. You need to drink
coffee is
water.
A diuretic. Coffee is not going to hydrate you. It is a diuretic. Oh my gosh, I love it. That's fabulous. And Gabby, I wasn't sure, did you have a skincare product that you were talking about or that you love to combine with your temperature treatment? And I know, Amy, you too, right? I guess you're the one doing it, but I don't want to distract you.
So
no worries.
The skincare that we're kind of shouting out this month is our, oh goodness, I'm here like, what were we talking about this week?
The Rewind Time?
The Rewind Time, which is an anti-aging serum. It does contain retinol. So for our dry eye patients, I still like to say to keep it away from your eyes. You don't want to be like going right on the lash line. But I do I'm sorry, Dr. Foley, I love retinol. I love it so much. And what's great about it is, one, retinol is photosensitizing. So you can't use it with IPL or other lasers, but you can with radio frequency. So I kind of, that's the one we're shouting out this week or this month. Otherwise, the Neck and Deck Envi, because if you're tightening up your face and then you get to tighten up your neck. And so that's also another one of my favorites, kind of to pair with radio frequency.
All right, so I'm just going to cut in really quick. So we've done around the eye. So now what we're doing is we've turned the energy down. So for Stevie, we started her at 26 energy, and we're just going to knock it down to 21 energy. We're going to take this little piece of whatever, and we're going to lift up on the eyelid as comfortably for the patient as you can. And then we're just going to get as close to that orbital or go right around that orbital bone. And so what we're doing is we're lifting up that lid to get as much of those binomial glands as we can without going over the eyeball. So we're just going to go around this for 40 seconds. Stevie, how does that feel on your lid like that?
Fine.
Good.
Okay.
So we'll do this back and forth for 40 seconds. I have come across a couple of times, well, more than a couple. The patients love it on the top lid, but it's a little too spicy for them on the bottom. If that happens, then we just turn the energy down. I do it in one increment. So if I'm at 21 and they're like, oh, it's spicy, so I'll turn it down. We use spicy instead of hot because we like that word better, because we're a bunch of spicy women working here. So,
AKA hot.
we just go down one increment at a time. So I'll drop it down to 20 if I need to, and if it's still spicy for them, I'll drop it down, like I said, one increment at a time.
Yeah, and it's definitely different for everyone, because for me, I feel it more on my lid. And then bottom lid, nothing. Like, you go as hot as you want.
You did? Okay. Essentially, what we're trying to do is do this without the actual corneal shields in, these plastic corneal shields. We will use those for chalazions and hordeolums, those big honkin' styes that people see occasionally. And then we usually follow up with IPL as well. It's more comfortable without the shield, so that's why it took us a while to get this technique down. And also too, when the shield goes in, that means I have to be the one doing it, which my schedule gets pretty hairy these days. So Amy is so flawless at this. It's amazing how much you just see gushing from the meibomian glands just from doing that. So super impressive. I think we have another question. Gabby, you want to grab this so I'm not causing feedback?
Let's, Terry said spicy glamour girlfriend club. Yes, ma'am.
I love Terry. You're the best. I don't know you, but I love you so much.
All right. So I just wanted to really quick say too, for radio frequency, you have to be grounded. No, it's a neutral pad. We try to get it as close to the area that we're treating. So we like to put it up on the upper part of your back, like in between your shoulder blades. But the worst part of that is it's cold, but it'll heat up quick.
Dr. Foley, and Amy, I guess for your dry eye patients that you have coming in, are you, I guess, how many people or percentage wise are you doing the ocular shield treatment with? And I guess maybe a dumb question or a redundant question is the result better now that and is it more comfortable for the patient now that you have the new Envi handpiece?
Oh, 100%. It's definitely better. The patients absolutely love the new handpiece. I don't think we've had one patient say, oh, I hate it. It's absolutely, our patients are loving the new handpiece. Absolutely.
I can attest, I was the first guinea pig because it was just like, you got to do it on me first before we do this on anybody else. And I was just in heaven. I just wanted her to keep doing it for like 2 hours if I could. Is that
it's funny, I get that all the time. Do you have to stop? Can you keep going?
I know. It's insanely wonderful. And back to your answer to your question, Lauren, is when we're doing these with the shield, it's literally maybe one a year now. That's about it.
Yeah.
It's very rare. It's probably more we're using the metal shields for IPL for someone who has really got a horrific ocular rosacea. That's typically more the issue. So it's wonderful. And again, it's more comfortable. We get great gland expression. We've actually seen some rejuvenation of glands too, which has been kind of impressive. Also with radio frequency, which we normally see only for IPL. So it's been wonderful. I think someone raised their hand. We had maybe someone wanting to ask a question, or maybe they hit a button by accident. I don't know.
Yeah, feel free to pop back in, guys.
Yeah.
Terry did say, "Yay, Amy."
I think Stevie's the real winner right now. Let's be honest.
Yeah, Stevie is the real winner right now.
Yes. What's really great is Amy and Gabby both make these procedures that you are coming in for. I just feel like you're having a spa treatment, and Amy does this lovely massage around the eyes, and then of course putting the moisturizer. And we always want people leaving with some SPF so that they're fully, you know, taken care of. You don't want that sun exposure going on. And I'm just impressed. And Gabby, can you speak to why it's important to have specific skincare so that we maximize the benefits of these treatments?
Yeah. So, I mean, first off, for a dry eye standpoint, you want to make sure you're not having any of those naughty list ingredients. So you want to make sure that your pH is in line, because if your face pH is at its normal, then so are your eyes. So that's going to help a tremendous amount with just efficacy of these treatments. So we want to make sure we're not, one, using anything that you can't use with IPL, and then two, that you're using stuff that's going to support the eye health. And then as far as if you were just coming in for beauty treatments, then that's kind of where we get a little bit more fun, where we can add in different serums or exfoliants or things that we can kind of customize a little bit more. But of course, I mean, 99% of people I see, it's dry eye. So that's kind of like my little specialty now.
Yeah. Well, and even like to your point, Gabby, and I don't know your full product line, Dr. Foley, but I would presume quite a few of those products help protect and boost collagen production. And so especially for aesthetic patients, or if there is a topical that fits the category of dry eye approved and great for the collagen boosting that you guys have, I would definitely recommend that for patients. People just get happier when they are, it's really a protection of your investment, right? These treatments aren't free, you know, you're spending money on them, and you want to make sure that you're encompassing that completely with the proper treatment care of your skin outside of the treatment room. Yeah,
definitely. And as we learn more about the natural skin biome and the pH of the skin, it mimics so much the ocular surface, and like your mouth, all of this is interconnected. And whatever you put on your face is going to either negatively or positively impact your ocular surface. We've seen folks where we ask every time, are you using your lid hygiene? Everyone knows is on this Zoom how important lid hygiene is. It's the foundation of our visual house, right? And if you're not using the proper ingredients, it can make this a nasty, nasty inflammatory space. We've had people using their hand soap, their antibacterial hand soap, and washing their eyes with it. Horrified. That just strips like paint thinner. Not good, not good. Even just regular facial washes are not good to use around the eyes. We want everything pH balanced. And so this is where Gabby has really helped us a lot, as well as Cynosure, and educating us eye doctors of the importance of skin and the natural biome and barrier here. So this is super critical. It's like a must-have to do these treatments properly. Well, I know it's that time where everybody's waiting for.
Really, Dr. Foley, I just wanted to break in really quick. I just want to make another point. I don't know if it was been said or not, but if you decide that you're going to, I mean, while you're doing these treatments, it's imperative not to get any kind of fillers or Botox done, because it won't last. It can
migrate. Don't.
Right. It will migrate. It will go where you don't want it to go. So we ask those questions, but just make sure that if you are going to do that, we need to know immediately.
Yep. Perfect. Is it party
And
time?
one other thing I just wanted to let you know that, so for that treatment for Stevie, it literally took 11 minutes for the treatment, not like the cleaning and all that. From start to finish, it's probably a good 20, 25 minutes. But for just the treatments, doing both of her eyes, it literally took 11 minutes.
Fabulous.
Yeah, it's great from being able to fit in more patients per day than we used to be able to do. So it's really made a huge improvement in that. Definitely. Thank you, Amy. That was so awesome. Now, do we have Stevie?
Of course.
She's going to be clicking in, and she's going to be doing our prizes.
Well, I think
right?
I'm on her technical difficulties because, why not? So I'm going to hop up and I'm going to have Stevie sit here. So
Okay.
2 seconds.
Awesome. Hey,
Gabby,
and Dr.
there was
Folt.
another question in there. Sorry, Lauren.
Yeah.
You want to speak to that one, Gabby?
So this one is from Cody. What do you do regarding patients on, I don't even want to try to pronounce metronidazole. It's an antibiotic. I don't even want to try to pronounce it. An antibiotic for rosacea. So rosacea, we always, of course, try to treat with IPL, but antibiotics plus IPL don't mix well. So that is, something where I'm not exactly sure if that antibiotic is something that you are able to get off of for treatments. I do think personally that IPL is kind of the best treatment for rosacea, but so we would not be able to do both at the same time. Most antibiotics, you have to be off of them for 2 weeks prior to an IPL treatment.
And that really comes down to the overall health of the skin. It's already kind of going through a compromising state with the antibiotic. Is that correct? And then of course we are initiating a histamine response within the body when we do either of these treatments. And so is that kind of where we're coming from with that, Gabby?
My kind of rule of thumb is anything that makes you sensitive to the sun, it's going to make you more sensitive to IPL, which of course, thankfully, knock on wood, I've never had anything bad happen with IPL, but there is always that risk of, people can get burnt. And it's if you are doing things like antibiotics or retinol, hydroquinone, things that make you more sensitive to it, where if those things kind of, we don't catch them, which thankfully we ask before every IPL treatment, have you had any new medications or any new topicals? So we do catch it when that does happen, but that's why I'm always asking everyone before they can go lay down and get all comfy. I always have to ask them all those questions and make sure. And there has been times where I've been like, oh, we need to reschedule. And of course, everyone's always like, come on, just do it. And I'm like, I can't. So yeah, we definitely don't mix them just because, anything photosensitizing, no go with lasers, IPL, any kind of light energy.
Awesome.
Okay. All right. I think we are switching over to Miss Stevie, who's been our patient extraordinaire. She's ready to go take a nap now.
I know. You said I couldn't. But before I get started, I just want to remind everybody that we are going to be switching the time in January. We're going to say a couple times before then. We're not only going to switch the time to noon, but we're going to have to switch the day to Tuesday. So it'll be the last Tuesday of every month at noon. So we can have a little lunch together. Because, I'll probably be eating because that's always what we do. So, just so we know. Okay, so I guess we should get started. First, I want to start out by saying anybody that calls me tomorrow, the office will be closed on Friday, just so you know. And it's fine. If you can't reach me and the office is closed, you can leave a message. As long as I hear your voice asking for that, I will call you next week and I will completely honor the 20% off any package.
Yeah, just mention the events tonight and you will still get the 20% off the package.
And you'll get 20% off Rewind Time. That's the eye cream. I love it. It's my favorite. I use it every night. And there are two. What am I doing here? Prizes?
Oh, yeah, that's what you did.
Yay! Okay, so the first one is rewind time. We're gonna give away a free bottle of rewind time. I got my little goodie over here. So I'm gonna pull up the first name. And Fulkerson.
Yay!
I love you. All right. The second one is
For a
full face radio frequency treatment. I hate doing that. I gotta do it like this. Okay. Hold. Okay. Michael Koss. Did I say that right? Okay. Michael K.
Michael K.
Michael K, you won the full face radio frequency treatment. Every female here wants to hurt you right now. And your body. So congratulations. Just give me a call tomorrow or Friday. Like I said, we're next week.
Hold up.
Okay.
We don't see Michael on anymore. You have to be present to win.
Michael just lost it.
Sorry, Michael.
All right, one more. Well, I have multiple more, so I hope you're there. Oh my God.
Who is it? Terry.
I'm gonna get, yeah, it's Terry, isn't it?
Oh my God. Wow.
Terry.
All these people in here are not happy with you. All right, we love you, Terry, and I'm proud that you got it. 'Cause you
Terry
deserve
plays
it,
the
girl.
odds. Terry's here every month.
Yeah.
And she's always popping off with the
Always.
questions. She's super engaged. And you have earned this. You have earned it.
Absolutely.
She's like, Terry says, unbelievable. Thank you. Oh, you are so welcome, Terry.
I love it. It's like, I just know when I go in there, I'm going to pull that name. Well, Michael would have got it, but God knows Terry deserves it.
Oh, well, thank you all. Gosh, this was great. And it was awesome. Thank you, Steve, for being our patient with the mostest here tonight.
Thank you.
Thank you, Amy, for doing that beautiful job of showing us how everything's done. And we have an awesome team
Of
here at
course.
Holy Vision Center. We've got Gabby, who will always answer all of your concerns or questions. She is our amazing advanced laser esthetician. Lauren, thank you again. You are amazing. You just bring it every time. It's so wonderful. I learn things every time. It reinforces things to me too. So constant learning. You two are hysterical down there. All right.
Yeah.
Thank you all.
That's not happening again.
Thank you each and every one for tuning in and staying with us tonight. We really appreciate all of you. Enjoy. Have a wonderful week. Take care.
Happy Halloween, everybody.
Yes.
Take care. Bye, ladies.
Bye. Music. Bye, guys.
Bye. Bye, Lauren.